Time now for a look at your health. The dizziness, shaking, blurred vision, all signs of a condition many people have had at least once, but they don't even know much about it. Dr. Mitchel Goldman from UCSD is here with more about hypoglycemia, the causes, the symptoms, and of course, the treatment. Thank you for being here.
Always good to be here.
So let's run down what's the difference between hypoglycemia and low blood pressure.
Well, low blood pressure is something where if you stand up suddenly, you feel really dizzy. But hypoglycemia is low blood sugar, and that's very different. Usually, as you can see, we have lots of different symptoms. The symptoms don't have to occur all the time, and you don't have to have all the symptoms at once. You can just have a few of them, such as you get a blurry or double vision, you have a bad headache, you're feeling cranky, which is especially important for kids because kids get cranky.
Yeah, let's put those up on the screen as you run through these because it's an extensive list.
It really is. Nervousness, headache, hunger, shaking, trembling, sleeping trouble, sweating, numbness or tiredness. But I found, at least with my kids, and I heard with your kids too, it's the crankiness. If you've got small children that are pretty lean and all of a sudden they're just really cranky for no reason, usually give them a power bar, give them something to eat, and that usually gets their sugar back up.
How long does this sort of hypoglycemic episode last? How do you know?
Well, it can last for a while. Usually it comes on pretty abruptly, like all of a sudden everything's going okay and then boom, you start to get cranky, feel dizzy, get lightheaded, and that can be a first warning. Now, people that have diabetes know all about this because when you have diabetes, your pancreas is not making enough insulin, and so your blood sugar will go very low, or especially if you take an insulin shot, it can drop your blood sugar a lot. So that's why people that have diabetes will test their blood sugars with a glucose stick, well, a little stick, drop of blood, and people that think they're having hypoglycemia can do the exact same thing.
So is the way to distinguish if you have low blood pressure versus low blood sugar perhaps that you're having a chronic feeling of all these symptoms, which would be more the low blood pressure? Yeah, the low blood pressure, it's the classic one is you're lying down or sitting down and you stand up and you get lightheaded. That's a low blood pressure problem. The hypoglycemia or low blood sugar, that's going to be a sudden onset of crankiness or something else that's going on. Now, there are other conditions that can cause it. Right. Besides, there's heart disease, severe infections, but one of the uncommon ones that actually can occur is a tumor in the pancreas called an insulinoma. This is a tumor that will secrete insulin, which drops your blood sugar, and the insulin isn't secreted all the time. So it can become very difficult for a physician to figure out. You need to do special MRI, CT scans in order to figure this out. But if you have these symptoms, it really is important to see your physician. Is there a way to prevent it? Should you be eating small meals all day and keep things consistent if you're someone that seems to have this hypoglycemic episode recurring, or what's your advice? It is. It's eat like a bird, small amounts, but not like a pterodactyl. You don't want to like eat huge amounts. That was over Thanksgiving. Now we have to buckle down. We already did that, but eating small amounts is good. Also, if you're very lean and you exercise a lot, make sure you've got some food in you because that's a prime area or prime time to start getting low blood sugar. All right, thank you so much. Good to have you back after the holidays. Yeah, it's good to be back. All right, let's check in with Lauren.